Amy Stevens, Kimberley Vet Surgery in Cobra, and my supervisor is Prue Chambers. So today I'm doing a mock parvo case. As in our surgery, our policy is that we don't video hospital cases as it could distract from the treatment of that case. The one that I'm doing today is a 6-month-old unvaccinated cavalier who presented with vomiting and diarrhoea, extreme lethargy and unwillingness to eat or drink.
Okay, describe and demonstrate the signs and symptoms of the disease.
So as I said before, vomiting and diarrhoea, extremely lethargic, looking quite sad and miserable, not eating and drinking anything at all.
Demonstrate the action that you would need to be taken for the animals affected and the other animals in the facility if an outbreak were to occur.
If there's a suspicion of parvo, when somebody calls, if they say that their dog is unvaccinated, it's vomiting or anything like that, and we suspect it, we will get them to wait outside in the designated area where no other clients or patients go, and the vet will go out to them with designated instruments like stethoscope and things like that, and PPE.
Okay, describe and demonstrate the treatment methods.
Okay, so aggressive treatment, fluid therapy, and IV meds, because anything orally will probably come back out.
Describe and demonstrate the patient accommodation and the isolation area, e.g. sustainable structure, bedding, ventilation and temperature.
Okay, so we have isolation cages in here. We don't offer any bedding as it holds too much contamination, just paper, and we often give the dogs a good clean and love, and so their mental state is good and they're not sitting in grossness.
Ventilation.
So we do have a window at the end. We try not to keep it too open to prevent any further contamination.
And temperature?
In the winter we do have a small heater down here which is set to a ideal temperature for this room to keep the temperature nice.
And in the summer?
We have an air conditioner out there,
yep,
which takes the heat off the air.
Beautiful. Describe and demonstrate the equipment kept in isolation, e.g. PPE, monitoring equipment, etc.
Yeah. So PPE is all here. We have gloves, we have gowns. The new gowns are here. The one that at the end of every case we throw away our gowns. So this is the one for this mock scenario. We would put that on, gloves, booties and all of that.
Mm-hmm.
And a sharps container up here to dispose of any sharps.
Okay. Okay. Describe and demonstrate the OH&S and PP requirement.
Okay, so PPE requirement would be gown.
Yep.
Tied correctly. Gloves.
And so how do you tie the gown correctly?
With the ties on the back.
Yep. And why would you tie it?
To keep it closed to prevent any contamination on your everyday clothes.
Yep. And then, so you always put your gown on first before your gloves?
Yep. And then gloves on. I'm not going to use a pair of gloves.
Yep. Describe and demonstrate food preparation.
So when the animal is eating again, we wouldn't bring the food down to here and then take it back up. We would use bowls that are correctly washed and sterilised with F10 or a correct parvicide.
Yep.
And we would take it up there, put the food in there and bring it down and scrub it and disinfect it before anything goes up to the main surgery area.
Okay. Describe and demonstrate daily cleaning step-by-step instruction.
Okay, so for cleaning, if our little cubby had made a mess in here, we'd come in, get him out, keeping your mind off his IV line, pop him in the cage next door, securing him safely in there. Again, I would be wearing gloves. Dispose of the newspaper into the isolation bin, and then cleaning with a normal cleaning agent. So cleaning the entirety of the cage, getting in all the cracks.
Mm-hmm.
Once that is then dry, using F10 because it is the correct agent to kill the parvovirus. Doing the entirety of the cage.
And what does the entirety of the cage include?
In all the cracks and crevices, all of the wire, all of that. Roof, walls, base, latches. Then we're good clean. Then once that is dry, replace with newspaper so the cage is ready for the next cleaning.
Okay. And if we have a really severe case where it's vomiting and diarrhea in bucket loads, what is the next step we also do to help limit contamination?
We would line the entirety of the floor with newspaper.
Yep.
So it doesn't get stuck in any grooves of the floor. Easily cleaned up. But again, scrubbing and F10.
Yep. Describe and demonstrate the waste disposal.
So waste disposal is sharps up here. So anything used down here goes into this sharps container and none else. We have a designated parvo bin. This is just a small one for in here. And then we will double bag, tie correctly, and cover the outside and wash the outside of the bag with F10.
Yep.
And contact the council for disintegration if they are available, but correct disposal procedures.
Yep. Also about leaving the room.
So we have a foot bath here. You would take off all your PPE.
Yep.
Spray clothes with the F10.
Yep.
For any contamination on there. And then walking into the foot bath on the way out.
Yep.
And only one person enters this room at any day. A verbal report is given to the vet at all times at each medication, especially at the end of the day, and histories are updated by her then.
Yep. Describe and demonstrate the cleaning of the unit of patient discharge. So when the patient goes home, what is our standard protocol?
Scrub everything thoroughly. Get
Yep.
the brushes out, all the wire, everything like that.
Yep.
Is then scrubbed with a cleaning agent, and then once dry, thoroughly disinfected.
Okay.
All floors and walls done.
Yep. And should we just do the one cage?
No, you should do all in case of any leakage, anything like that.
Yep. If when the patient goes home, do we give him a bit of a bath and send him home nice and clean? And
Yes.
yep. Describe and demonstrate the records in which must be maintained.
So usually we would have a cage card to fill out any drugs, time given, input and output, foods, etc. The histories, the client histories, patient history on the computer, and things like that.
And what about any, like our hospital, like we record everything on there so that if
there was someone new to come down, that they know where this animal is up to, how it's progressing as the days goes on. If it has gone backwards from what it was yesterday, there's all notes on there.
Yep. And why do we only have one person designated to the area?
To prevent any further contamination.
Yep.
The less people we have in the area, the less foot traffic, the less chance of taking into the surgery.
And our protocol about clients visiting their animals once they're in hospital in isolation?
They are not allowed.
Why?
Because it's, like I said, it's more foot traffic. They don't need to come in and then take it out with them and spread it and all of that. We try and ease the contamination.